Hi, I'm your Van Dyken, MD. I'm a surgeon by trade, but my true passion is helping people just like you obtain optimum health by adopting a whole foods, plant-based lifestyle. Let's talk about curcumin, the active ingredient in turmeric. What's the best dose? Is it safe? How do you take it? Who should use caution when taking it and who should not be taking it? So curcumin can be taken in many forms. I suggest using the turmeric root in your everyday cooking. It's always best to use whole foods whenever possible, so the root is an easy way just to throw it in whatever you're making. 1.5 to 3 grams of the cut root daily is an optimal dose. Turmeric powder is also easy to use in your cooking for curries and the like. Sprinkle it on your salads. 1 to 3 grams daily is ideal. About 1 gram is about half a teaspoon, so this translates to about 1 to 1.5 teaspoons a day. Not much. You can get your hands on some curcumin powder, which is different from turmeric powder found in the spice aisle. And a dose for this would be 500 to 600 milligrams 3 times a day. You can also find curcumin in the form of a 1-to-1 extract. This dose would be 30 to 90 drops per day, and a tincture 1-to-2 ratio dose would be 15 to 30 drops 4 times per day. Of course, you want to spread out your turmeric intake throughout the day, so dividing the dose into 2 or 3 parts is wise. And remember, try to combine your turmeric with black pepper, which will increase the bioavailability by up to 2,000%. Nuts or other fatty foods combined with the fat-soluble curcumin will also help you absorb more of that awesome goodness. Curcumin is generally regarded as safe. Clinical studies have used doses of all the way up to 8 grams per day for months at a time in cancer patients, and its dosage has been shown to have minimal toxicity. Despite that, though, there are still some people who should not be taking curcumin. Let's go over them. The first group of people are people with gallstones or gallbladder obstructions from gallstones. These people can experience increased pain when taking curcumin. You see, curcumin has been found to increase gallbladder contractility, and when you have existing gallstones, this can cause discomfort. The second group of people that should use caution with curcumin are the pregnant and breastfeeding women. Turmeric has been shown to be a uterine stimulant and should be used with caution. Also, high doses of curcumin can cause DNA breakage in vitro or in a test tube, and we just haven't done enough studies establishing that high doses of curcumin is safe for this population. Of course, a small amount of plain turmeric in regular everyday cooking, just fine. Turmeric has been shown to increase the risk of kidney stones. So we know that turmeric contains soluble oxalates which can bind to calcium and form calcium oxalate, the crystal that's responsible for over 3/4 of all kidney stones. So if you're prone to kidney stones, better to take the supplement curcumin rather than the spiced turmeric. It's less likely to precipitate out. The fourth group of people that should use caution when taking curcumin are people that are at a high risk of bleeding. High doses of curcumin can interfere with and inhibit blood clotting, so you want to use caution when you're taking it if you're on blood thinners or if you're getting ready to undergo major surgery within 2 weeks of taking it. The fifth group of people that should use caution with curcumin are people who have diabetes. Turmeric and curcumin work so well in lowering blood sugar that it can cause blood sugar levels to become dangerously low. So use it with caution. Always let your healthcare provider know and start out with a small dose and slowly increase it as you can tolerate it to avoid those dangerously low blood sugar levels or hypoglycemia. The last and definitely not the least important group of people that may want to avoid high intake of curcumin are those trying to get pregnant, both men and women. Multiple studies have demonstrated the inhibition of sperm motility with high curcumin intake. One study even found that curcumin completely blocked forward sperm motility. Amazing. So to that end, scientists are even evaluating it as used as a contraceptive. More on that in a later video. So if you're one of those people trying to conceive, maybe it's best to use turmeric in moderation and avoid those high doses. That concludes all of the super useful information I have for you today, folks. Thank you so much for watching. I hope you learned something valuable and applicable to your individual health journey. If you like this video, please give it a thumbs up. If you want to show us some real support, subscribe. We love hearing from you guys, so please comment below with your thoughts and your questions on the material covered. And also let us know what you want to hear about and what health topics you want to learn more about. Until next time, aloha.